So today I'm going to be talking about women's time use and the Productive Safety Net program in rural Highland, Ethiopia. So for those of you that are not familiar with Ethiopia, it's located in the northeastern part of Africa, also known as the Horn of Africa. So it is right here. It shares a border with Somalia, Eritrea, Djibouti, Sudan, South Sudan, and Kenya. And it's a mixture of a desert on the eastern side and mountainous and rainy in the central and western parts of the country. The government is structured as a federal parliamentary republic. However, they've only had 3 heads of state under their current constitution, and the longest head of state was in power from 1995 until his death in 2012. It is the most populous landlocked country in the world and the second most populous country in Africa, with a population of 109 million people. And it was one of the first empires to officially adopt Christianity, which took place in the 4th century. It's pretty cool when you're traveling around the country. They have all of these ancient churches and ruins that you can go visit. Currently, approximately 44% of the country is Ethiopian Orthodox, 34% is Muslim, and 19% is Protestant, with the remainder kind of being a mixture of a few other things. Deforestation is a major concern. Forest loss has contributed to soil erosion, loss of nutrients in the soil, a reduction of biodiversity, and food insecurity. And about 85% of the labor force is engaged in agriculture. Ethiopia aims to gain a lower middle income status by 2025. It's currently categorized as a low income country by the World Bank. However, despite their ambitions, it's still one of the poorest countries in Africa, with an average per capita income of only $790. And since I am in the Division of Nutritional Sciences, we cannot leave out the nutrition facts. So the prevalence of underweight in women of reproductive age in rural Ethiopia is 25%. And there is a strong linkage between being impoverished and nutritional status, as was highlighted by Robert Black and his colleagues in a 2008 Lancet paper. They linked underlying causes of nutritional status, such as poverty, low assets and remittances, to things like household food security, the access to adequate care, and that's both adequate care from the caregivers, such as the mothers, and also access to health care and the healthcare system, and also the household environment. And by that we mean wash indicators. So do they have an improved latrine? Do they have hand washing facilities? Are animals residing in the same places as humans, exposing children to things like feces and whatever bacteria is in that. And so then from the underlying causes, we jump to the immediate causes, such as dietary intake. And dietary intake is usually refers to the quality of diet and dietary diversity. So not necessarily the caloric consumption, but are people getting enough diversity in their diet that they're consuming the micronutrients that they need to, and disease. And so that's related to nutritional status. And nutritional status impacts morbidity, mortality, and disability, and also economic productivity. And not surprising, it's a cycle. So people of poor nutritional status will have an increase in morbidity, disability, decreased economic productivity, and that leads to an increase in income poverty, and you keep going through. One way that governments try to address income poverty, food insecurity, and poor nutritional status is through social safety net programs. So social safety net programs are used by governments to address those things that I just mentioned. And there's different types of social safety net. These include unconditional and conditional cash transfers, social pension, food and in-kind transfers, among others. So food transfers would be something like the SNAP program, or more commonly referred to as food stamps in the US. Public works are just one type of a social safety net. For the past 13 years, Ethiopia has had a public works program called the Productive Safety Net Program, or the PSNP. So the PSNP is the main exposure that we are looking at in my dissertation. And it will be referred to frequently. So PSNP is one of those acronyms you want to remember. Beneficiaries of the PSNP receive cash or food payment in exchange for work on labor-intensive public projects. And these public projects address environmental degradation, improved water control, and increase to road access. The PSNP is active in what is called the dry season, and that's when households are not engaged in agricultural activities. Remember, I said 85% of the labor force is engaged in agriculture, but that's still only during one of the seasons. So during the dry season, when agriculture is not really going on, the PSNP is active, and the idea is that the PSNP is preventing the poorest of the poor households from using up their household savings when they don't have another source of income. And so the programs are improving community assets while also protecting the household assets. And existing research has shown that the Public Works Program in Ethiopia has improved many of the economic outcomes that it intended to, but it has not had the expected impact on nutritional status. So, slideshow. This is one of the Kabeles. Kabele is one of the smaller administrative districts in Ethiopia where the PSNP is active. So you can see that this is actually supposed to be lush and green due to deforestation. It looks much more dry, arid, and desert-like. And life there is not easy. The household is at the top of this mountain, and most of the activities, such as the agriculture and water, are down below. So people are constantly having to go up and down the mountain to access their basic needs. So this is the framework from earlier. So we're focusing on the PSNP as the social safety net. So let's look a little bit at the impact that the PSNP has had on some of the underlying and immediate causes of nutritional status. So the first one we'll look at is income. Income is measured by household consumption, which is the per person household expenditure on all items. So they aren't looking at how much money is coming into the household, but how much money is going out. And household by the PSNP public work beneficiaries has nearly doubled in all regions, and a statistically significant percentage of that expenditure has been going towards food. And so we have a check mark next to that underlying cause. The next one we're going to look at is food security. Food security has been measured by food gap, or the number of months in the previous period where the household was unable to meet its food needs. Typically, the period is 12 months, but when we're collecting data multiple times a year, they just sort of look from the last data collection to the current data collection. So it will shift a little bit. The data I'm going to show you is per 12-month period. So the food insecurity improved significantly in the PSNP regions. The average PSNP beneficiary reported a food gap of about 3 months between 2006 and 2010. And then by 2012, this had dropped to 2.4 months. And had dropped even further by 2014 to 1.75 months. In addition to overall food security, the incidence of severe food insecurity has also dropped. So severe food insecurity would be if a household reported not being able to meet its food needs in the previous 5 out of the previous 12 months. And so in 2006, when the PSNP started, the number of households reporting severe food insecurity was 26%, and by 2014, this had fallen to 8%. So we have that underlying cause addressed. And then we have some perceived benefits. So this is all information that was collected by qualitative surveys. not quantitative. So this is what the respondents perceived the differences being. And so they perceived that there was an increase in access to social services, including healthcare facilities. And they also perceived that there was an increase in access to clean water. Two of the activities that the PSNP does is they build healthcare facilities, which are not the hospitals you would think of here, a lot more basic. It's a place for a community health worker or a nurse to be stationed. And they also build wells and places where to pipe water from. So we have checks on those two underlying causes. However, the same research has shown that there has not been an improvement in dietary intake. So diet quality is still very low. I think the dietary diversity hovers around 2 out of an option of 10. So that pretty much means that people are just consuming grain and typically a legume like chickpeas or lentils or something. And then nutritional status has also not improved. Nutritional status is measured by BMI in women of reproductive age and child stunting. So there's been no changes in that. And so the objective of my dissertation research is to look at potential mechanisms that are blunting the impact of the PSNP on the nutritional status of women and children. I'm not going to go that in depth into the nutritional aspects, but that is overall what I'm looking at. And I'm only looking at 3 mechanisms. There's potentially hundreds, but I can't measure hundreds in the course of a dissertation. And so my specific aim is to determine that if living in a household that benefits from the public works component of the PSNP has inadvertent negative impacts on women's time use, physical activity, and physical function. So the idea is that the constraints on time, the increase in physical activity, and a decrease in physical function might be bypassing these components that have had a positive impact and directly impacting things like dietary intake, disease, and nutritional status. Today we're just going to focus on the time use component. Okay, so time use research generally is an interdisciplinary field that is dedicated to learning how people allocate their time during an average day. It is one of the few fields that investigates what people do both inside and outside the paid economy. So what are people doing when they're not at work? And then it tries to identify human behavioral patterns and determine how these change over time. Over time, between countries, between genders, different socioeconomic groups, pretty much between any social group. And it is frequently used in urban planning and design. So how does community design impact people's time, and what can be done to improve work-life balance? Transportation planning. So where and when should public transit be scaled up? Health. So how can we encourage people to be more physically active? And the subfield that relates most closely to what I'm doing is feminist economics. So how does non-market work affect gender equality? And in case you think that this is just something that's done in developing countries, the American Bureau of Labor and Statistics runs the American Time Use Survey, which has collected over 200,000 interviews between 2003 and 2018. So time use research really can include anyone, not just developing countries. Okay, so specifically, I want to talk about women's time use in rural settings in developing countries. So in these settings, in comparison to men, women bear a disproportionate work burden. They have what is considered a triple work burden, where they're expected to spend a significant amount of time in productive, reproductive, and social spheres. This disproportionate work burden and the triple work burden lead to what is called time poverty, which is something I'm sure everyone in here has experienced before. It's the idea that there's not enough time to do all the work that we need to. And so for women in rural areas, they're usually thought of as the gatekeepers of the household and of the community. And so time poverty in women in rural areas in developing countries can negatively affect their well-being and health, the health of their families, and also the food security and the prosperity of their community. So it's not just them, but it's everyone that's affected when they're experiencing time poverty. And so I'm going to give you a little slideshow of my recent trip to Ethiopia so that you get a sense of what the work burden is like in this area. So here you have a woman who is collecting fuel wood for the fire so that they can cook and keep the house warm. Ethiopia is much colder than you would think sub-Saharan Africa is, especially in the Highland areas. And so her bundle of wood is much larger than she is. And if you think it's just the women of the household or adult women of the household that are engaged in these activities, here I have a picture of two little girls. Their primary activity is likely herding their goats, but at the same time, they're going around and they're collecting fuel wood for the household. This is a woman who was selling chickens by the side of the road, not in any formal market. You can sort of see the landscape behind her, and that's what everything looked like in all directions. There was nothing. Fortunately, my driver decided that he needed to get chicken for his household, and so he bought a rooster, which spent the next 4 hours in the trunk of our car. But you know, she was sort of just sitting by the side of the road in the middle of nowhere selling the few roosters that they had available. And if anyone's beginning to think that I'm picking on men and saying they aren't doing their share of work, here we have a man who is harvesting, I believe it's sesame. So most of the agriculture in the region has very low technology adoption. So you will see people sort of in this position hunched in the fields for hours, like all day they're hunched over. They're, they're planting, they're weeding, they're harvesting. Everything is pretty much done like this. And then they carry the whatever they've harvested back to their household or their village or the market. So as you can see, when we say they're engaged in agriculture, they aren't driving tractors around all day. They are doing intense physical labor. Okay, so a little bit of the background on the study. So this is the larger study that I collected my data on. So it was collected as part of an ongoing impact evaluation on the economic and nutritional outcomes of the fourth phase of the PSNP. It took place in the dry season and then the rainy/agriculture season of 2019. The PSNP is operating during the dry season, which occurs in the spring, and the rainy season is the main agricultural season, which occurs in the fall. There are 88 enumerations, which were randomly selected in the 5 highland regions of Ethiopia. And so this is, once again, we have the country, and all of these little red dots are the areas where we collected data. So it was, we got a wide range of regions. And the households were included if they had a child between the age of 0 and 24 months. It's important to note that allocation to the PSNP is not random. It's based on need. And the criteria for inclusion is dependent upon the Kabele, which is the administrative district I mentioned before. So there's no set criteria that guarantees that you're in or not. Approximately 1,200 households responded to the time use module, and they were randomly selected for inclusion at the level of the WAREDA. And the time use module was asked to the mothers of the index child. So the index child is this 0 to 24 month child that was required for inclusion, and then also to the heads of households. Okay, so a little bit of information on the households where we collected data. The average household size was about 6 people. They usually had about 2.5 adults, so members over the age of 15. and they usually had about 2 children under the age of 5. About 10% of the heads of households, which I will have abbreviated with the triple H for the rest of the presentation, were female. Although only 7% of the female-headed, or 7% of the households, of the mothers that were interviewed were also the heads of households. 85% of the mothers were married to the heads of households, with the other relationships being maybe the parents were the heads of households or an uncle, something like that. And it's important to note that about 89% of the fathers of the index child, so the spouse or the partner of the woman who we interviewed, were members of the household. Okay, so let me see. I think I'm going to just skip through this side. It's a little bit of background on how time use is collected in general. This is the actual tool that we use to collect time use data on the household members. I took some components of the American Time Use Survey, some components of the Women's Empowerment in Agriculture Survey, and then I added a few things that were relevant to my dissertation work. So things like this intensity level, because physical activity is one of the main outcomes that I'm looking at. A lot of time use surveys will ask very specifically what people were doing, so they want to know the difference. Were you dusting? Were you sweeping? Were you doing some sort of household construction? That wasn't important for my data, so we put things into larger categories. So all of that would be in domestic work. For crop production, that would include all of the harvesting, weeding, planting. And so we have the day is broken down into half-hour increments, starting from about an hour before sunrise to an hour after sunset. And so for each of these half-hour increments, we asked, what did you do? And they would reply with what is called the primary activity. And then, were you doing anything else, which would be the secondary activity. Not everybody's day is broken down precisely into these 30-minute increments. And oftentimes people are multitasking, so by having a primary and a secondary activity, we're able to capture that. Additionally, we ask specifically if a child under 3 was with them. I'm sure if you talk to parents anywhere, providing childcare doesn't always register as an activity. You know, the child is with you, but maybe it's sleeping, it's on its own, it's doing something. But we wanted to know where the child was, or when the child was with them and when it wasn't throughout the day. And then we wanted to know if they were providing passive care. So like I said, maybe the child's sleeping, playing on its own, doing its own thing, or if they were providing active care. So were they feeding the child or soothing it, something like that. And so then we broke it down. And so from those 28 categories that I showed before, we compiled them into some smaller categories. So we have any sort of child, adult, or elder care, food-specific categories. So we have time spent cooking and preparing food and time spent eating or drinking. We compress those two for a lot of the analysis on women because they will be preparing food and eating at the same time and kind of going back and forth. It's not two discrete activities. We have personal care, activities that increased access to food by either producing or purchasing food, and then the things that increased access to food by increasing income, walking and traveling, domestic activities, and then sort of an other/leisure category. And there is a general other category that we're still working on reclassifying. So here we have the minutes that mothers spent in the different categories in both the dry and the agricultural season. So we have minutes on the y-axis. The total minutes in the day that we collected was 840. We didn't collect the full day, just sort of that hour on either side. And then, so this The pink is women, are mothers during the dry season that did not benefit from the PSNP. The striped pink is women mothers in the dry season who did benefit from the PSNP. The solid red is mothers in the agricultural season who did not benefit from the PSNP. And then women in mothers in the agricultural season who did benefit from the PSNP are the red striped bars. And so you can see if we look at childcare, between the dry season and the agricultural season, the amount of time dedicated to childcare decreased for both beneficiaries and non-beneficiaries. There wasn't that much of a difference between the amount of time dedicated to cooking and eating between any of the groups. Food production increased in all groups between the dry season and the agriculture season, which is expected because it's the agriculture season, so now they're actually out in the field doing what needs to be done. Income generating activities was fairly low. This domestic activity is almost zero, but it's still included in there because as we go through and I recategorize some of that other, there's going to be more time that's dedicated to domestic activities. And then we have traveling or walking, personal care, and leisure. So a few observations from this is that, that's for a different, so the pattern is similar in the dry season. Okay, we'll skip that. Okay, so now we have time use in the dry season, and we're comparing the heads of households, who are predominantly men, to the mothers. And just as a note, if the mother was the head of household, which was in about 7% of the households, her information is included in the mother's category and not in the heads of household category. So we can see that the mothers are primarily responsible for providing childcare and cooking and eating, and the heads of households dedicate a lot more time to food production and income generating activities. Not surprising, since these two activities are likely outside the household. They also have an increase in time that they spent traveling, but they also have an increase in personal care and leisure activity. These asterisks indicate that there's a statistically significant difference between the heads of households and the mothers. And so the heads of households also have more time dedicated to personal care and leisure. And in personal care were activities like sleeping and resting. So it seems like they have a lot more unstructured time. And it is similar in the agriculture season as it is in the dry season, where it's still the mothers that are predominantly responsible for childcare, cooking and eating, and the heads of households are predominantly responsible for food production and income. And the heads of households also still have more time to dedicate to personal care and leisure. Excuse me. So that's just recapping what I was saying. And so, as you can see, the children were not always with the mothers. The child, so this is the total amount of time that the child was not with the mother during the day. There are increases in the amount of time the child was not with the mother in the agriculture season compared to the dry season. And there's an increase in the amount of time the child was not with the mother in the PSNP beneficiary households compared to the non-beneficiary households during the agriculture season. The opposite is true during the dry season. So one question I had was, what were mothers doing during the time that their children were not with them? So it's a little bit of everything, but the main activity was food production. And you can see that the most of the increase in the time that the child was not present with the mother was when the mothers were engaged in food production activities. Here. And then, for the most part, everything else is fairly close in the other categories between the 2 seasons and between the non-beneficiary households and the beneficiary households. Okay, so that's all the data I have to present for you. As I said, this has all recently been collected and I haven't had time to do some of the analyses. Some of the stuff that I'm planning on doing is to disaggregate the time spent without children by parity and household demographics. I've done it by child age, but that wasn't in the main presentation. I want to conduct an analysis that looks for associations between nutrition and health outcomes and mothers' time use. So mothers that spend less time, let's say, with their children, do their children have poor IYCF indicators? And for mothers that spend less time on cooking and eating, do they have a lower minimum dietary diversity for women, which is the main indicator that's used to determine diet quality among women of reproductive age in this setting. And then the main funder for the study was the Bill and Melinda Gates Foundation. And so we're kind of compiling everything, and we will have a final report to hand over to them by the end of the year. And so some things that have been done with other time use research that I thought was pretty interesting. As looking at the way that women spend their time, there's been increased investments and access to time-saving technologies such as mills for processing grain, improved agroforestry practices for fuel wood collection. There was one really interesting project where they basically went through and planted a bunch of trees, native trees that women could then take branches from for cooking fuel. The rehabilitation and construction of facilities for childcare. So one of the things that we don't really know is where's the child when they're not with the mother. And so making sure that there is appropriate places for those children to go. And then also to increase access to improve tillage implements, draft animals, and micro-irrigation. I don't think I meant implements there. Tools, basically, things so that people can, and then also the construction and maintenance of piped waters in communities, which is one thing that the PSNP is doing. And so with that, I would like to acknowledge the Bill and Melinda Gates Foundation, who is the primary funder of the study. I am supported by the NIH NIDDK Translational Training Grant. My advisor is supported by the H.E. Babcock Fund, which is where I got a lot of the funding to do my own research. And of course, the Aware Travel Grant, which not just gave me money to go abroad, but also gave me an opportunity to present my work. So with that, I'll take any questions or suggestions that you might have. Yes.
Did your interviews suggest any relationship between the PSNP program and migration? Does that social safety net program reduce the out-migration of young adults or seasonal migration of men? Or
I'm not entirely sure. We haven't looked, so like I said, it's all pretty new, so we haven't really looked at the migration aspects and the changeover in households. I would imagine that providing men with a source of income during the dry season would keep them around rather than sending them elsewhere. And overall, the households that we visited, there was low permanent migration. Most of the young adults stayed in the area, at least in the households we interviewed, which were sort of the poorest of the poor, I think in slightly higher economic households, they were more likely to move to urban centers to look for work. Yes?
I have a question. So when you were talking about the heads of households, and you mentioned that women who were female heads of households were considered in the mother category. Why was that? Why were they not considered in terms of statistics for heads of households, even though they were heads of households?
So the main thing I'm looking at is the mothers. So when the mothers were the heads of household, I kept them as the mothers because we want to know what is their interaction with their child, what is the amount of care that we're looking at. Like that's sort of the primary component of the research that I'm doing, but there is definitely an argument to be made for other research to include them in the heads of households as opposed to categorizing them as mothers. Yes?
Yeah. So maybe two questions actually. First is that I really didn't see very much difference between PSNP versus non-PSNP in terms of time allocation on almost all categories, except maybe time spent in agricultural land and that was maybe not even significant. So did you measure how long they were actually investing in PSNP public works and how much of their time that was actually taking? Did you measure that? And is it quite a small amount of their time? And the second part, I think, is that I think there was a study in about 2015 which looked at time allocation in just a small area in IFPRI, suggesting that one of the impacts of PSNP public works is we could spend less time investing in building and maintaining terraces and woodlots and things like that on their own land as opposed to doing public areas. Is that something you would have any data on?
It's likely that we do have, so I know that we do have data on the first component. We ask, there's a whole separate module in the questionnaire that asks the amount of time or the amount of days in the last month that they participated in the PSNP and exactly what it was they were doing. I just don't have that included in here yet. This was just 24-hour recall. And so in the day prior to administering the questionnaire, participation in the PSNP was pretty low. I think but that's also just two of the household members. You know, like we said, I think there is a little over almost, if you round 3 adult household members that are able to participate in the PSNP. So it could be that there is a household member that is not the head of household or the mother that is participating in the PSNP. And so it was, the amount of time that they were dedicating on their own land. I don't think we have information in this questionnaire that would do that, but there is a new time use study that's getting underway by some economists that used to be at Cornell and have moved elsewhere. And it's a much more intensive time use survey. They're using mobile technology and they're texting people multiple times a day asking them what they're doing. And it is in the Amhara region. It is near Lalibela. So I think in the next few years we'll have a much clearer sense of whether that's true for everyone. Yes?
Yeah, in a similar vein, is it possible for you to disaggregate direct food aid through PSNP versus potential crop productivity increases as a result of PSNP earthworks or agroforestry systems or terracing?
Yes, there is. The group that I'm working with does do the main impact evaluation, so they have multiple studies over multiple months of the year, and they do have a lot more information on the PSNP, just not stuff that was included in the analysis that I'm doing right now. But there's a lot of information out there on it.
Is that part of the qualitative assessment by participants that are they seeing increases in yields?
I'm not sure. There's a lot of data, and I haven't had a chance to look through all of it. I know that they're doing their end line next year for the phase 4 on the main PSNP impact evaluation, so I think that next year we'll have a lot more information on how it's impacting yields.
Will your research actually be fed back into the government's programs so that they're able to change things if they need to improve these nutritional things?
That's the dream. I know that there is a lot of interest in women's time use, at least among the Gates Foundation, and to see how they can provide time-saving technologies. And I hope that it will be taken up by the government. But we'll have to see where the priorities are when the next round of money is distributed.
Are there difficulties in communicating?
No. The actual data is collected by the Central Statistical Agency, and most of it is fed directly to the government. So this is funded by the Gates Foundation, but the other round, the main impact evaluation I mentioned, that goes directly to the government. Anything else?